Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello again, it's Christopher Cunny, and welcome back to another episode of Straight Outta Healthcare IT. I'm so excited today to have my first millennial on my program, who is an amazing young woman that's doing some really cool things in the design of new healthcare applications. And I wanted to bring her on to really talk about this next generation of technologies that are going to impact our healthcare ecosystem. So let me introduce you to Myriam Zahedi. And before we get started, I want to give you just a quick rundown of Myriam's impressive background. So Myriam Zahedi is a designer, researcher, and strategist passionate about creating meaningful experiences that help people's lives. Through the process of understanding human needs and formulating insights, she applies her diverse background in digital, physical, and spatial design to create new products, services, and systems that are meaningful and impactful for the customers interacting with them. Myriam is currently a senior product designer at Apple. Immersed in digital healthcare landscape, she has been applying ethnographic research methodologies and learning interdisciplinary brainstorming sessions to inform and inspire design ideas at high-tech startups such as 23andMe, January AI, and Pivot. She's through cross-disciplinary collaborations, Myriam has leveraged elements of behavioral change and game mechanics to motivate people to make informed lifestyle changes to reduce their risk of developing preventable diseases so they can take charge of their long-term health and well-being. In addition, synergistic collaborations and multidisciplinary teams where she's excited about making things and experimenting with new ideas are where Myriam finds her flow the best. As part of a project solving for motivating teams to drive safer, her team was granted with 2 patents. Congratulations. Wow. Myriam graduated from Stanford University with an MS in product design, focused on design thinking methodology for innovation. She received her bachelor in architecture from California College of Arts, where she was awarded with the American Institute of Architects Certificate of Merit. Most recently, she was named by Forbes as one of the 16 healthcare innovators that you should know. Wow, look at you, girl. Go for it. Congratulations. She enjoys walking in nature, reading books, exploring and sharing wonders of everyday moments with friends and family, and all things that bring her joy. Wow, what an impressive resume for such a bright young woman. So without further ado, let me welcome Myriam Zahedi to our program. Welcome.
Hi, thank you so much, Christopher. Thank you for that very generous introduction. I'm so glad and honored to be here on your podcast today.
I'm happy to have you as well. And it's my understanding, is this your first podcast that you're doing?
It is, yes.
Wow. Well, welcome to your very first, and I'm sure of very many in the future podcasts. I'm so excited to have you on the program. So before we get started, I want you, and I read that impressive resume, but I'm sure that doesn't tell us the true story of how you started out as a person interested in studying architecture to now designing applications for the healthcare market. What an interesting transition. So I want you to share a little bit about your background, your journey, and how you ended up working for Apple as a senior product designer.
Absolutely. Yeah. So I did start my career. I wanted to be an architect. That was sort of the thing that I was going for. I've always been interested in creating spaces where people can have different experiences, going from one room to the other and sort of playing around with, just spatial experiences. And as I finished my architecture degree, throughout the degree, I was also very much doing hands-on, building things and doing installation work. I got more interested in actually building things sooner. And so I decided to look into tech design. And I came across this design thinking methodology, which incorporates human-centered design. And for the first time, I understood the value of interacting and collaborating closely with people. And I felt like that was the missing part for me when I was doing architecture design, is really understanding who is it being designed for, and getting that feedback early on. And so, one of the courses I took there was called Need Finding. And we would actually go out and talk to folks and really test out ideas before they were even built. Yeah. And that's kind of how I got into this field, into the digital world.
Right. A novel idea, right? Actually talking to the people about the applications they want to use and how they want to use them, right?
Yeah, and a lot of times the focus of human-centered design is less about kind of validating ideas, and it's more about like, what is the problem? What are the pain points? What are these needs? And when you hear people's stories, you really sit down with them and you feel like these are your pain points. You're designing it in some ways as a way to really, be part of a larger community. And so, that was the part that really connected with me really well. And so over time, I got more into, first it was innovation teams, kind of working on prototypes and testing ideas and seeing, what kind of strategies work. And then it turned into getting more into the healthcare space and health tech. And that's something that's really been great, because I feel like, one, as a designer, you could be designing for anything. And so health and well-being of people, that's something that, has a really good impact, as well as I get to learn myself as well, as I'm designing and working, collaborating with others about these things. So behavior change became sort of the evidence-based content and the nudging. And I learned a lot working with behavior scientists and throughout that time, incorporating that with design. Yeah. And then the last aspect of that was game mechanics. And I wouldn't say gamification, but
hold off on that, because I want to delve into that in more detail. But I did want to start initially with this whole concept of human-centered design as well, too. And I wanted to just share a little bit of commentary related to that. And, given my journey with technology and healthcare, when you look at some of the main systems like the electronic health record system, for example, that was originally designed to really capture financial data, clinical data, but to be used for financial purposes to process a bill, basically, or to process a claim. And over time evolved into these tools that then clinicians could use to replace the paper chart, and then ultimately used to actually deliver some level of clinical care. And now, as we've added things like clinical decision support and AI to these platforms, they now become more of an advisor and a resource for clinicians to make smarter decisions. The challenge we have, though, with these systems today is that typically, because of the way they were initially designed, they have a huge impact on the cognitive workload on the clinicians, and even for the patients who are trying to navigate the patient portals and things of that nature, which adds to an increase in clinician burnout, frustration, and dissatisfaction, and ultimately can lead to medical errors, inaccurate coding and billing, and again, increased dissatisfaction amongst the clinicians as well as the patients that ultimately are wanting to navigate the healthcare system as well. It's my understanding now that this concept of human-centered design is, to your point, a methodology, a way of understanding the user's desires, needs, frustrations in some cases about the existing solutions. So maybe you can, expound on that a little bit more. I mean, for those who may not be familiar with this term, human-centered design, what does that really mean? And how is it now being applied into technologies that are being developed in healthcare?
Yeah, that's a great question. I think what I've learned over time is that it's kind of being an advocate for the people that we're building things for, designing for. So, a lot of times when we're making decisions, we think about business viability, we think about our technological capabilities, And we also need to, at the same time, care for, what are these pain points and making sure that whatever we're designing is actually working really well. There's a need and there's some kind of a solution, and kind of being able to match those together. Yeah. And so a lot of it is, instead of guessing and making a ton of assumptions and having biases about, what these people would expect, it's about kind of saying, we don't know, starting with, we really don't know. Let's put aside our assumptions and actually go talk to people and go test out ideas and co-create and collaborate. So that's what it's about. And it's about, not labeling people as patients or data points, but rather just people, humans. And so I think a lot of it is also the terminology affects it in terms of when we're designing, kind of sitting together with someone else and doing it together.
No, that's great. I mean, again, what a novel idea of actually sitting down with the folks that are actually using these technologies and understanding how they will impact them. And then, designing the UI, the UX, the user experience around that feedback. I know that organizations like HHS, for example, have implemented methodologies through a project they have called Health Plus, which is this kind of human design research model sponsored by them to co-create solutions with people impacted by the most pressing health challenges. Health Plus models positions people as active participants and experts in their own life challenges, and they're listening and learning from these folks so that they can build the better applications going forward. So we're even seeing, our major governmental institutions like HHS starting to adopt this concept. Maybe you can share with us a little bit about what you're working on at Apple in terms of some of the projects that you can share in terms of how you're applying this concept of human-centered design.
Yeah, I would say, throughout the projects, just really caring about the sort of context of, who's using these applications, why are we designing these? It's a lot about reframing the problem and trying to figure out, trying to spend time problem finding a lot, and then thinking about the solution afterwards. And that has definitely in the past also just really been something that's been helpful in terms of spending more time trying to just figure out, why are we doing this? Who is it for really?
Absolutely. And are you primarily focused on applications that touch the patient, or are you focused on applications that are touching the clinicians, or maybe a little bit of both? And if so, again, or maybe you can talk a little bit about one or more specific applications that you're focused on. I know you've worked with organizations like 23andMe, as you mentioned in your bio, and others. Just curious what's going on there at Apple as well.
Yeah, mostly from my past experience, it's been working on well-being, health and well-being space.
Exactly.
So specifically, it's for general population typically, but if somebody cares about a specific aspect of their health, then also having solutions to that. So in past experiences, it's just been based on whoever was sort of needing some kind of care, kind of making sure that there was a program for that.
No, makes sense. You also mentioned, and I stopped you earlier, you were about to go down this concept of gamification in the design of these products. So tell us a little bit for, again, those who out there who may not be aware of what that term really means. Maybe you can share a little bit of insight on that, and then how gamification is being applied to these applications to help incentivize individuals to adjust their behavior or reward them for adhering to whatever protocols that have been designed to improve their health.
Yeah, absolutely. So, like I mentioned, there's 3 aspects that I feel like work really well together. So if we're thinking about the why, it would be the human-centered design as in terms of the problem space.
Right.
And then the what is the behavior change, the way that the content is put together and the nudges. And then game mechanics would be the how. And so a lot of that experience, the interaction is about how do you onboard someone?
Exactly.
How much information do you tell them? And games do such a good job with this. There are no tutorials really. You just go in and you start playing, you level up, and you just kind of over time. So I think that's kind of the reason of using the terminology of game mechanics. It's like mechanics of how games work. It's just so easy for anyone to go into it. And
Sure.
over time, depending on, someone might need more information, someone might need less. How much visualization should we put there? And then obviously, rewarding people with points or seeing their progress over time. So all
Exactly.
of these things, knowing when to add them. When do you kind of use things like leaderboards versus when is it going to be something that's more collaborative and everyone
Sure.
does something together as a team?
Makes
So
sense.
those are all really exciting about like the way that, the sort of the system works.
No, absolutely. Human nature, is such that we love to be rewarded. I guess that is it. What is the part of the brain that's impacted when you receive rewards and things of that nature? I know gamification is based on a lot of that concept as well too. And so it is interesting to see how individuals' health can be improved by the use of these types of methodologies as well. We talked about some of the kind of the cool things that are going on in the space. I'm curious, what's been some of the challenges and issues you've faced in, designing these applications based on the concepts you just talked about?
I would say a couple of things, specifically with healthcare. I would say regulations and data privacy are
Right.
definitely very, very important. And data privacy is like the most important thing. People want to make sure that they could trust companies with what they're providing, and we definitely respect that. And that's something that I really care about as an advocate for people using it, to
Exactly.
make how are we using this data and what are we doing with that. And then on top of that, it's healthcare typically tends to be on a slower. If you have to have FDA approvals or things like that, I've definitely gone
Sure.
through those processes at some other companies. So those just slow things down. So it's a bit of a challenge being in the tech space as well as healthcare. But it makes it like a good challenge.
No, absolutely. No, absolutely. I think we're all dealing with this whole privacy protection issue in healthcare, and that remains to be kind of that holy grail of how do we continue to evolve as an ecosystem and developing these next generation applications, but also being sensitive to the patient's need to protect the privacy of their data as well too. So I can appreciate the challenges there. I do want to kind of pivot a little bit on the topic and really talk more personally about your journey as well too. 20 years ago, and much longer for me, but 20 years ago, when I got into this game, you looked around the room and, most of the folks in the room were 25 to 45-year-old men who were, developing these applications and systems. Now, you're starting to see more and more young women, females, start to play a very integral role in this. What's been your observation, your journey as, a designer of next generation applications, and also bringing the lens of the female perspective to this industry, and any kind of challenges or observations you may have experienced through your journey?
Yeah, it's one of those things where I think with design, typically you want to get people from all sorts of cross-functionally. The
Right.
more you have diversity in the team, the more your biases are questioned and someone else comes in with a new idea and you get to see better. Your blind spots are, you get more perspectives. And so a good team in any situation works really well when it is that way. And so I feel like, nowadays we're kind of moving in the right direction. And, it's with having had mentors in the past who have been very supportive and very caring and thoughtful, good leadership that is really, really important in every company and every team. And I think that is something that makes or breaks it. And I've been really fortunate that I've had very, very good mentors over time who have now been both mentors and friends over time. And that's
Great.
been great.
That's good. Any specific advice that you could share with, other young women who are interested in making a mark and becoming one of the 16 health innovators you should know? Any words of wisdom and insight that you would impart upon them?
The biggest lesson that I've learned over time is to really, really put your heart and soul into the work and then test early, prototype, learn from, the people that you're designing for, and just make sure that you get that honest, valid inputs, and you know how to integrate that. That has been key in terms of just moving forward and iterating. So, not spending so much time trying to make something perfect, which a lot of designers want to do before showing it to everyone,
Right.
and just prototyping early and not being afraid of failing. You just, sometimes some projects, just don't work out, but you learn a lesson from that and you apply it to something else. And that's been a valuable lesson.
That's great. That's great. And then and again, not that I'm trying to get you to say, there's been a bad experience or whatever, but I'm just curious, as a female in this space, have you experienced any particular biases or challenges or obstacles you've had to overcome for your voice to be heard, or, for your ideas to be adopted? And if so, just your general thoughts on how did you manage through that?
Yeah, I mean, sometimes it can be difficult, especially as you're starting off in your journey.
Sure. Even as a millennial, right?
You're sitting in a big room, a lot of stakeholders, and
right.
You're trying to kind of talk about this idea. And it takes practice. It takes a lot of, I guess, learning from mentors of what to do and creating that space to be able to do that. So it has definitely been challenging over time, but it gets better. I mean, throughout time, it just, you get to learn and navigate it.
Absolutely. And so what are some of the cool things you want to continue to work on, or as you see this industry start to emerge, you see things like AI and machine learning that's becoming more accepted in healthcare and being a part of the development of these applications. What are some of the things, you see that you, one, would like to be involved in, two, that you see where the industry is going in the design of these applications?
Yeah, AI definitely is huge. It can do so much with personalization. I mean, a lot of times what we're trying to do is provide insights or things that are helpful to, an individual, and everyone's so different. And so being able to know specifically more about someone and being able to put the data together to be able to coach someone as a friend through the application, those things are very valuable, because otherwise, if it's just generic feedback, then a lot of times that's not actionable. And
exactly.
we want for health specifically, it's just so important for things to be meaningful and actionable experiences.
Yeah. No, absolutely. You talked a little bit about, the journey you started as an architect, studying architecture and then ultimately moving into the role you're in. Were you able to take any of those studies and apply it to what you're doing now in healthcare design, software design? Because a lot of people like me, for example, I started out as a designer, software designer. Back in my day, we called them programmers. And now I'm doing something completely different than actually writing code. But I was able, I think, to apply a lot of the things I learned throughout my career to what I'm doing today. I'm just curious, for those individuals who may not have initially started out as a designer, but they chose a different career profession. I'm just curious were you able to apply any of those learnings from your studies around architecture to what you're doing today?
Absolutely. There is so much that translates so well into digital product design, I have to say. When you're doing architecture, you have to think about the context. You have to think about how one space relates to the other. When you're designing for, let's say, an app or a website, again, it's like, who is it for? What is the context for this? And then, how do they navigate? Where do they click on or tap on? And how do they get from one place to the other? Then you have to collaborate with software engineers, in architecture, structural engineers, or it's very similar. It's funny when I explain it, I'm like, oh my gosh, I never expected them to be so similar in terms of the collaboration, as well as the way of thinking about blueprinting versus the details.
Exactly. No, that's great. And I said this earlier to you when we were prepping for the interview, time will pass so quickly when you're having these conversations. And true enough, time has passed really quickly. And so we're actually at the end of our our interview here. And I'm just curious, did you have any specific words of advice or wisdom, or just any thoughts that you'd like to convey to the audience that you haven't shared yet about your journey, about what's happening in the industry, just your overall perspective on what's going on with human-centered design?
Yeah, I guess for last words, it would just be, really thinking about how someone will experience what you're putting together, and if it's a system thinking,
Right.
how do the pieces come together? How does the piece that you're working on affect the entire ecosystem? Really trying to look at the big picture and then look at the details going back and forth between them, and really putting yourself in the shoes of the person using it. I feel like that has been the North Star guiding me in terms of, just making sure that it's usable, it's delightful, and it creates a, meaningful experience that's impactful for someone.
Absolutely. No, great advice. So I've got about 1 minute here, so I'm going to do a rapid fire question section. This is hopefully fun and not too stressful for you. First question, name one thing you've done on your bucket list and one thing you yet to do on your bucket list.
All right.
And I know your bucket list is probably a lot way farther out than mine, but just curious.
I'm actually going to say something that's been meaningful in my own life, I feel like. And that has been very simply just a moment of walking with my son on the beach. Nice. And just, dancing away and just being ourselves and seeing our footprints be so impermanent, and kind of just thinking about the impermanence of life and these moments that you could just capture. Absolutely. So that has been something that I can check off as a member.
Nothing more special than spending time with your children, right? And watching them experience and be fascinated about nature and just the world in general as well. It's such a beautiful thing. One thing on your bucket list you haven't done yet.
So this one is, I would like to learn to drive with a stick shift and do
Do they still make those anymore?
Off-road rally driving. I have a friend who believes in me and thinks that one day I can do it. And friends are so important, and so maybe one day I'll try that.
Wow, that's great. I didn't even know they even made cars with stick shifts anymore now. So that would be interesting to see that happen. Name a book or an author or a movie maybe that really sticks with you and was one of your favorite, or just had such an impression on your life.
One of the books that I really enjoyed reading and I've been coming to over and over again is called The Power of Moments. It's by the Heath brothers, Chip and Dan Heath. And even though it's not specifically about design, it is about experience. Basically. And so that has been, I recommend that to designers as well as everyone else, creating meaningful experiences.
That's great. And then last question, and I know the answer to it, but I'm going to ask it anyway. Bourbon, tequila, wine, scotch, or other?
Sparkling water.
Sparkling water, absolutely. A great choice. The safer choice, that's for sure. Absolutely. Well, again, thank you so much for taking time out your busy schedule to chat with me and let me be your first host for your first podcast. I'm so excited. Hopefully it was a painless experience for you. And I look forward to seeing you not only on mine, but on many, many more in the future. I wish you much success in your journey and look forward to you transforming our industry with human-centered design and gamification strategies, and just your overall positive energy that you're bringing to this ecosystem now. So thank you for being my guest. Happy to have you.
Thank you so much, Christopher. Thank you. It's been a pleasure, and I really enjoyed this session. Thank you so much for giving me this opportunity. Thank you.
You're very welcome. Well, that's it, folks. That's another episode of Straight Outta Health IT is in the books. Thank you again for your continued support of this program. As always, your comments and feedback are always welcomed and taken and incorporated into improving this program. This is definitely a journey and not a destination. Once again, thank you for all your support. Have a wonderful day. God bless, and one love.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.